Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Health promotion and maintenance. A student nurse interns at an outpatient health center. Which of the following responsibilities of the student nurse are considered tertiary prevention strategies? Option A. The student nurse administers a PPD test for employment. Option B. The student nurse prepares a sterile field before cleaning the inner cannula of a tracheostomy. Option C. The student nurse gives Bactrim to a patient with a UTI. Option D. The student nurse gives a presentation on diet and exercise. Right answer is Option C. The student nurse gives Bactrim to a patient with a UTI, the flu vaccine, the sterile field, and the presentation on diet/exercise are examples of primary prevention. The PPD test is secondary prevention. Giving Bactrim and giving acyclovir are examples of tertiary prevention. A patient with rheumatoid arthritis complains to the nurse that exercise is very painful for her. What does the nurse recommend to the patient? Option A. Use ice packs on the joints that hurt after you exercise. Option B. Try taking a warm bath in the morning before you begin your exercise. Option C. Do not exercise if your joints hurt. Instead, try again the next day. Option D. I'm sure it doesn't hurt that much to exercise, right? Right answer is Option B. Try taking a warm bath in the morning before you begin your exercise. Exercise will always be painful for a patient with rheumatoid arthritis, but if they skip exercise, they can develop contractures. Warm baths and heating pads can help to loosen and relax joints for better function with less pain in exercise. The home health nurse visits a patient with HIV who lives alone in her apartment. Which of the following observations the nurse makes while in the patient's home is most concerning? Option A. The dishwasher is broken and the patient complains that she has low water pressure throughout the whole apartment. Option B. The patient has a cat who purrs loudly. Option C. The patient has a bowl of fake fruit on the table. Option D. There is an open container of food in the refrigerator. Right answer is Option B. The patient has a cat who purrs loudly. The open container of food in the refrigerator needs to be addressed, but the cat is more concerning. The cat's feces could contain toxoplasmosis, an organism dangerous to immunocompromised patients. An adolescent male tells the nurse that he recently found out his friend has testicular cancer and he's worried he has it too. He describes a soft, movable mass that has not altered in size and is not painful. What is the nurse's best response? Option A. Oh. Do you have a family history of testicular cancer? Option B. Even though the lump is not painful now, I'm still worried. Let's get it checked out. Option C. That must have been scary when you found out your friend had cancer. Option D. I can't say whether or not you could have cancer, but it is best for me to take a look and schedule you for a few tests. Right answer is Option D. I can't say whether or not you could have cancer, but it is best for me to take a look and schedule you for a few tests. His assessment is vague and not entirely typical of testicular cancer. It is best to do follow-up with an ultrasound and possibly biopsy to make sure it's nothing. Testicular cancer does not run in families, and most cancerous lumps are not painful. The nurse is discharging a patient who had recurrent kidney stones. Which of the following statements, if made by the patient to the nurse, would be considered correct? Option A. I will eat a low-calcium diet because kidney stones are made of calcium. Option B. I will restrict my water intake to 1,500 milliliters per day. Option C. I will make it my goal to drink 2 to 3 liters of water per day. Option D. I will eat a high-sodium diet. Right answer is Option C. I will make it my goal to drink 2 to 3 liters of water per day. Patients with a history of kidney stones should eat a low-sodium diet and increase their water. Eliminating alcohol does nothing to prevent kidney stones. The nurse in the neurology unit cares for a patient diagnosed with CVA who is ready to go home today. The patient suffers from hemiplegia and dysphagia. Which of the following statements, if made by the patient's wife, indicates that further teaching is necessary? Option A. A peanut butter sandwich and tall, cold glass of milk is Bob's favorite lunch. Option B. We will change our daily schedule to 6 meals per day, rather than our usual 3. Option C. I will have Bob sit up for about 20 minutes before we start eating and for an hour afterward. Option D. I will always ensure that Bob is finished chewing before I give him another bite of food. Right answer is Option A. A peanut butter sandwich and tall, cold glass of milk is Bob's favorite lunch. A peanut butter sandwich and milk is too sticky/thick for a patient with dysphagia and he is likely to aspirate either of them. It is good to have him sitting up, finish chewing one bite before another, and eat 6 smaller meals for the best energy conservation. A 5-month-old boy is brought to the clinic by his parents for a routine visit. Which of the following observations would require an intervention by the nurse? Option A. The child cannot walk. Option B. The infant has gained 7 pounds since birth. Option C. The child abducts his extremities and fans his fingers when he hears a loud noise. Option D. The child cries when he sees the nurse. Right answer is Option C. The child abducts his extremities and fans his fingers when he hears a loud noise. It is normal for the child to have gained 7 pounds since birth, doubling weight, which is normal. A 5-month-old cannot walk. The moro, startle, reflex, however, should have disappeared by 4 months of age. The nurse works at an outpatient health center and receives a call from an adolescent girl who was recently prescribed the birth control pill. She describes an awful leg cramp that turned the skin red. Which of the following statements, if made by the nurse to the patient, is correct? Option A. This is a normal side effect with the pill and should go away after the first month. Option B. We'll need you to come into the clinic to be evaluated immediately. Option C. Do you play any sports where you could have injured yourself? Option D. Has this happened before? Right answer is Option B. We'll need you to come into the clinic to be evaluated immediately. This is the most feared complication of birth control pills, a DVT. The girl needs immediate evaluation and treatment. A 5-month-old boy is brought to the doctor's office by his mother for a well-child visit. Which of the following, if observed by the nurse, would reflect a developmental delay? Option A. The child, when lifted by the arms, displays head lag. Option B. The child is able to sit with support on the examination table. Option C. The child babbles, but cannot speak any real words yet. Option D. The child's weight has increased, from birth, by about 7 pounds. Right answer is Option A. The child, when lifted by the arms, displays head lag. Head lag should disappear by the end of the 2nd month. A 5-month-old can sit with support, babbles with no real words, and has doubled their birth weight. The nurse teaches a 20-year-old female how to perform SBE, self-breast exams. Which of the following instructions, if given by the nurse, is incorrect? Option A. Use your index, pointer, and ring fingers to firmly palpate the breast in a circular motion. Option B. The first position you will use to inspect your breasts is to stand with your arms at your sides. Option C. The best time to perform your SBE is at the end of the month. Option D. Remember that breast tissue may feel tender at times, and this is normal. Right answer is option C. The best time to perform your SBE is at the end of the month. The best time to perform SBE is 1 week after the onset of the woman's menstrual period, when hormones are at the lowest. It is normal for hormonal changes during the month to make breast tissue tender or enlarged. The other options are correct as well. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.